All right, let's go through some more notes for anatomy for the skeletal system. So we're going to talk about the vertebral column today and the thoracic cage, aka your rib cage. So let's start with the vertebral column. There it goes. Okay. So I've already heard some of you all use these terms in class, and there hopefully is no more confusion over this because I think I've cleared it up. But just so we're clear, there are some other terms that are the vertebral column goes by. On our exams and quizzes, I will call it the vertebral column because that's what it is. All right, it's a column of vertebra, individual bones. Sometimes though people call it the backbone, they call it the spine, they might call it the spinal column. What we don't want to call it is the spinal cord. Okay, the spinal cord is inside of the vertebra. All right, so inside these, okay, like imagine this is kind of opening through here. That's where the spinal cord fits. That's a big bundle of nerves that connect to your brainstem and then to your brain. Okay, remember we want all that protected. You don't want any of that exposed. So that's why we have that. But the spinal cord itself is not actually part of the vertebral column. It is a separate entity. We'll learn more about that in the nervous system unit. Okay. So how many individual vertebrae do you think make up the spinal column, especially in a mature adult? Remember, our number of bones shift as we get older because of ossification and all that. So you think it's 12, 26, 33, or 45. So you could pause the video and just start counting here. But I warn you, in certain parts, it's kind of a trick question because like down here, it's fused. There's actually 26 altogether. Don't stress out about the number or anything like that in terms of learning 26 more names, because remember, you should be practicing all the bone names we've learned so far so that they correct all the cranial and facial bones. Because remember, we're just going to keep adding to it. But in terms of the number of vertebrae, don't stress too much. For the most part, they're pretty easy to know in names because they all kind of have the same naming and then they have a different number depending on what section you're in. And we'll get into that. Okay. So what kind of bones, we talked about the different types of bones, beginning of the unit, excuse me, what kind of bones are in the vertebral column? Ask yourself, what are they? Sesamoid like the patella? Are they long bones like the humerus or the femur? Are they flat? Are they short? Are they irregular? If you guessed irregular, you've been paying attention. Good job. Okay, so we know it's made of 26 irregular bones. All right, make sure you're following along on your notes and writing this down because I don't grade notes usually. Who knows, maybe I'll do a check on these, maybe. But either way, the 26 irregular bones. If we did not have a backbone, you would not be able to move, you would not be able to stand, you would not be able to sit, you'd not be able to do a whole lot of things. It'd be kind of a bummer, right? So we know the vertebral column, its functions, just like it's very similar to the functions of the bones themselves. It is to support the body, specifically the upper body. We know it protects the spinal cord. We've talked about that. It's also a point of attachment for other bones, such as like your pelvic girdle, your thoracic cage, which we'll talk about. Obviously, your neck leads up into and connects to the base of your skull. Okay. Okay, so I've come across it several times before. A lot of people tend to think that the vertebral column needs to be like perfectly straight up and down like a stick. That's not actually how it is. It does have a little bit of a curve to it. That's actually healthy. That's normal, like you can see in this cartoon here. If it was perfectly straight up and down, it would actually not be able to support as much weight and be as functional. So this is a good picture here. So think about this bridge. Okay, this is curved here, and it's actually supporting more weight. It's distributing the weight in a different way. That's important for engineering as well as functionality in terms of the human body. Now, there are cases where the spinal curvature may be over-exaggerated, whether it's from an injury, a congenital thing that leads to a possible disability. There's genetic defects like spina bifida. There's kyphosis, where you can get like the hunch, like hunched over. That can come with age, like osteoporosis can lead to some of those things. So there's different reasons for that, but a healthy spine does have some curves. You can see in this image here, it kind of curves like this. Okay, that is healthy, that is normal, that is going to distribute the weight in the pressure the best. That allows for the most range of movement, the most support. So we'll pay attention to the color scheme as we go, especially on your notes. If you, some of you are doing really good with this whole changing the pin colors and things like that, those definitely help with learning anatomy. Okay, your brain is going to pick up on the different cues and the different colors. It's going to help you remember. So if you remember cervical vertebrae are pink and you use a pink pen, it might help. Okay. So your cervical vertebra, okay, that's your neck. All right, and there are 7 total. The dog is barking. Of course he is. Shh. So here's our skull, our cranium. We've talked about that before. Remember how I talked about how there is this little bump here called the occipital condyle? So that is critical for basically conjoining or meeting up. I should say not conjoining because they're not attached, but meeting up with the first vertebra. So your cervical neck, your neck vertebra are the smallest. I mean, you can see that from the picture, but you can also just think about it logically. Your neck is smaller, right? The first one is C1. So all these vertebrae, when I said they're all named pretty similarly and just a different number, so we call them the C1, C2, C3, so on and so forth, because C for cervical, and then 1 for what number it is, 2 for, and so on. So, but C1 and C2 get their own special names because of their functions. So C1 is named after Atlas. If you know anything about mythology, Atlas was the guy who held the world on his shoulders, okay? So the atlas, or your C1, supports the head, okay? That is where it has those occipital condyles. That allows the head and the neck to come together. And this is also going to allow you to nod yes. So up and down like this. That is the atlas at work, okay? So if you know your mythology, this one's an easy one to remember, okay? You will need to recognize it on a quiz as C1 or atlas. I will use either name. Fair game. Then we have C2, which is axis. This one has a little projection on it called a dens that the atlas kind of fits on, and this allows you to turn your head like this, okay? So if you think about what an axis is, okay, the Earth spins on an axis, okay? So an axis allows for kind of sideways motion. That's how I keep them straight. So Atlas had the world on his shoulders, and axis allows for spinning. Then we move into the thoracic vertebra. Okay, you're going to find this is going to come up again in our next set of notes. So your thoracic cage attaches to this area. This is your thoracic part of your body. So like your chest cavity is your thoracic cavity. So this is the part of your backbone behind like your heart and your lungs and things like that. There are 12 here. Okay, and again, we start with these are called T vertebrae. T is in Tom. So T1, T2, T3, T4, blah, 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 blah. I'm not going to count to 12. I think you know how to do that. These are a little bit bigger than cervical vertebrae, right? They're the medium sized. Then next up, we have the lumbar vertebra. They're in the orange, okay? These are your lower back. So like if you've ever seen any sort of like a gaming chair, like what I'm sitting on, like a lot of them, they will advertise, oh, these have great lumbar support. What does it actually mean? It means it has usually like a curve to the back of the chair toward the bottom where your back would be, toward your lower back, and that's showing it's supporting that lower curvature of your spine so that it's more comfortable to sit in for long periods of time. Because gaming chairs were designed for what? Sitting in front of a game console for hours on end. So we want your lumbar vertebra to be comfortable. Okay, so these are 5 in number. Okay, here in the orange. So again, L1, L2, L3, L4, so on and so forth. The way to keep it straight in my head of how many is in each section without physically counting them on my quiz, because that takes time. I'm not saying you can't do that. I'm saying you'll be wasting time. Because what if I don't give you the picture and I say how many is in the lumbar? You go, oh no, I can't count. It's not there. So here's how I remember it. Breakfast at 7, that's your neck, for 7 vertebra. Lunch at noon for 12 thoracic vertebra. Dinner at 5 for 5 lumbar vertebra. Okay. Breakfast at 7, lunch at noon, dinner at 5. You remember those 3 numbers, just go down the column. You're already halfway there. TD, I beg of you, stop licking your feet. Oh my God. Okay, next is the sacrum. That's a green section down here. This is what's attached to your hips. So in this picture, this is a frontal view, all right? It's this area in here. So these up here would be lumbar, L4 and L5. Down here is the sacrum. Okay, if you'll notice, we also have a little purple section here. So it does not go all the way down. There's one more section. So in this one, it is this area right in here. So it originally used to be 5 bones. By the time you're my age in your 30s, it'll be 1. Okay. Gigi, stop it! Take of you, stop. Oh, I hate that sound. Okay. We'll talk more about the pelvic girdle in another set of notes. But you can see here, there are, this is cartilage here between in the pubic symphysis. That is one of the ways like childbirth can happen, is that cartilage will have some give, so the mother can give birth. We'll talk more about that in the second note set, and I'm trying to not get ahead of myself here. The licking dog is distracting me. Blame her. Blame her. Okay, then we have the coccyx down here in purple. That is your tailbone. So if you've ever heard anyone say, I bruised my tailbone, that means they fell on their butt and they bruised this area down here. And it hurts sometimes. Okay, so your tailbone originally was more. Now, by the time you're an adult, it's down to 1. It goes from 4 to 1. So it went from 5 to 1 for the sacrum, 4 to 1 for the coccyx. Oh my God. Come here. Come here. Come here. Come here. I'd rather you sit up here and look at the camera. It drives me insane. That's my hair. Okay. Hug acquired. She's very proud of herself. I can sit further back. All right. All right, so characteristics of the spinal column. So you'll notice on this picture, in between are these little blue sections. That's not for artistic funness. That is actually an intervertebral disc. So just like if you go buy a new pair of shoes, right? They have some cushion in the shoes, right? And they are very bouncy. They are very comfortable. Same thing here. Same reason you sleep with a pillow under your head is we want a cushion. You don't want bone touching bone. That leads to erosion of the bones. It's very painful. It limits movement. Yeah, it's not a good situation. So these cartilage discs, fibrocartilage specifically, because remember we talked about different kinds of cartilage at the start of the year. These cartilage discs are there to act as shock absorbers. They are there to act as cushions, as support, just like you put shock absorbers on a car. Okay, they're there to absorb some of the shock from the road. That's what's happening here with the intervertebral discs. So anywhere you see a little blue, they're between all the vertebrae. They're not fused like down here. So again, spine does have some curves to it. That is healthy. So there are 4 curves named after the regions of which you can find them. So the cervical, the thoracic, the lumbar, and the sacral. Okay. We are seeing a whole lot more of this phenomenon happening right now. So you guys know you love your phones. You love your phones. Okay. But what does that phone in your hand make you do to your neck? It makes you look down like this. Over prolonged periods of time, that adds stress, wear, tear, etc. to your neck. That's why your neck can hurt after you've been like hunched over on a phone all day. So your neck is actually really strong and really durable. It's made to support weight. Your head is actually quite heavy. Okay, an adult skull with brain and all the other stuff is about 10 to 12 pounds. That's quite heavy when you think about it. Like that's basically a bowling ball. So you got a bowling ball balanced on, your neck, which is bone and everything, but still. Over time, as you can see from these images, the longer and more pronounced that angle of looking down is, the more stress you're putting on your neck. So if you're constantly, like this is what I see, between 30 and 45 degrees, walking around just like, it's like, okay, put the digital pacifier away, walk and hold your head up, please. It'll be good for your neck in the long run, because I know you're probably thinking, well, I'm a teenager, I'm invincible, I'm not in pain. This can add up over time. Okay, so you've got to take your neck health seriously and put the phone down, or if you really must use your phone or whatever. Like I've seen all of these like new Kindle holder devices. You know, they're on a stand and it's like right in front of you versus looking down. That's better than nothing, you know. Okay, so if there is someone who has a hunchback, the technical medical term is called kyphosis. It's an abnormal curvature of the thoracic part of the spine specifically. Again, it can be caused by different reasons, typically related to some other medical condition like osteoporosis, things like that. Okay, I'm so sorry. I'm so sorry. TD says hello. Hello. So this is kyphosis is specifically in the thoracic curvature. You can see the comparison here. Follow the dotted line of where the normal curve should be versus here's kyphosis to see how the dotted line does not line up with the spine anymore. So then see how it kind of sticks out a little more. Now there are different degrees of kyphosis. That would be for a doctor to diagnose, obviously. TD, don't fall. But you can see just with this slight change, see how the curvature has changed. More is kind of pushed back, essentially, like it's sticking more outward, right? And then there's a third one here. Like, wait, what's that? Excuse you. That is lordosis, which is the abnormal or extreme curvature of the lumbar portion of your spine. So again, follow the nice pretty pink line. This one is where your stomach is going to stick out more because the spine is pushing that way. Okay. So we want this, but if something happens, accident, congenital defect you were born with, disease like osteoporosis, something like that. Lordosis, I think, is more congenital, if I remember right. But kyphosis can definitely happen from diseases. I've seen it firsthand. Just got everything. All right, and then there is scoliosis, which is where the spine starts to kind of curve to the side. And this is for most of the spine. It's not just like one particular section. Again, this is why people used to wear like back braces and things like that. I'm not sure if that's still the medical treatment. I think to a point it is. I have to double check that. But this is where they're trying to like figure out what's going on with your spine, if it's normal. If you've ever done any sort of physical for a sport, you have had a scoliosis check. They have looked at your spine. Okay, because if your spine is not the where it should be, you are putting other areas of your body at risk for injury. We don't want that. So that's why when you get your yearly physical for whatever sports ball you play, they're going to check your spine. They listen to your heart, all that stuff, right? Okay. So that is the main overview of the vertebral column. Now let us skip to the thoracic cage. Oh no, something made a sound. Don't you dare bark. All right, thoracic cage. So you probably would, if I were to put this picture up just as it is, you'd be like, oh, that's the rib cage. That's not wrong, but we're going to use the anatomical term because this is anatomy. So remember we talked about the thoracic cavity at the beginning of the year. We talked about body cavities and planes and all that stuff. So the thoracic cage is your chest, basically, specifically the bones of your chest, okay? So just like it sounds, it's a cage. It is there to protect. We're protecting the really important stuff, your heart, your lungs. Down here, there's a little bit of protection for your kidneys. And your kidneys are like, remember if I told you they're kind of just like hanging back there. They're not really attached and protected by a whole lot. It's also got a lot of great attachment points for your neck muscles, your chest muscles, the back muscles, your shoulder muscles. So all those you work out with, all those main big muscles you will learn in this class, a lot of them attach here, okay? So inside this thoracic cage, or a part of the thoracic cage, I should say, we've got the vertebra itself, okay? We've got the backbone. That's why I did that one first. We have the sternum, which is here in front. And then, of course, the ribs themselves. Okay, so the sternum has three main parts to it. we've got the manubrium here at the top. It looks like a little tie to me. Okay, so like the clip-on part of the tie, because I don't know how to tie a tie. The clip-on part of the tie is the manubrium. The main part of the tie is the body, and the very tip, very end there of the tie that, you know, looks all fancy is called the xiphoid process. All three of these bones are fused together. Okay. Sometimes people call this the breastbone. We're going to call it the sternum. That's what you're going to see on your quiz or your test. Okay. All right, so the sternum specifically, so we've got the manubrium up here. That's this area right there. That's what that is what is attaching to your clavicles. Okay, clavicles. Then the body here in the middle portion, that is attaching to the costal cartilage of the ribs. So anytime you see the word costal, it's usually talking about something to do with the ribs. In this case, this is all cartilage down here in this kind of bluish purplish color in this diagram. So if we had just straight rib attaching to the manubrium, so bone attaching to bone, you would not be able to breathe effectively. Not the way you do now. There would be no deep breaths. Okay, you sit there and go like you would not be able to breathe properly. Okay, because your chest actually expands a little bit when you breathe. So you've got the diaphragm down under here, which is helping push up and, you know, control the pressures and raise things up and down. But also this costal cartilage is allowing the rib cage to expand a little bit. So that's why you can take deep breaths. So if you're in a sport that requires any sort of like breath holding or anything like that, like I was a swimmer, that would have been a lot more difficult if the ribs were attached directly to the manubrium here, to the body of the sternum. It would be much more difficult. Okay. And then down here, the little pointy part, that's the xiphoid process. That is mainly there to attach different muscles to it. Yeah. I lost my train of thought. It's gone. So the main focus of the sternum is to protect the heart. It's pretty much right over it. So here is our person. You can see the thoracic cage here. Here's the lungs inside here. The right lung, the left lung. Here's your heart. Okay. And then the sternum here is going to be right in front. Okay. So I know you seniors will have to do the CPR certification stuff for graduation. If you ever have to give CPR to someone, I don't know why this was never taught to me in my CPR classes as a kid. I learned it as an adult. Don't know why. But either way, especially in older folks, if you have to give CPR to an older folk, because sometimes they need it. So this sternum is right over the heart. Well, this whole point of CPR is to keep that heart pumping, right? So if you've ever seen any sort of CPR on a, you know, medical drama, whatever, they're doing very, very shallow compressions. Okay, that's not actually going to do anything for the person you're trying to save. If anything, you're just looking like a fool. So to do true compressions, you really got to put some weight and effort into it. And that's why the CPR is so physically taxing on the actual caregiver. And one thing they did not warn me about is the fact that when you do this, especially for older folk, you're going to hear and feel bones breaking. That's this. And sometimes the connections with the ribs. Yeah, no one warned me of that. Maybe it's because I was like a little kid. They're like, you don't need to know this. But yeah, don't be alarmed if you feel / hear the sternum giving way when you're doing CPR. That means you're doing it right. Keep going. Okay, save the person's life. If you don't feel any of that, you're not putting enough effort into it. You might as well pass the buck to someone who knows what they're doing. Okay. Okay. I encounter this a lot. And I mean, I was even taught this fact, so to speak, as a child because Bible school. True or false? The male skeleton has one less rib than the female skeleton. What do you think? No. Again, this goes back to certain religious doctrine and things like that. You can believe whatever you want to believe. I don't care. But in anatomy class, it's very clear. We have the same number of ribs. Okay? That's all you need to know. Okay, so let's think about this. How many ribs does an adult skeleton have? Okay, remember they come in pairs. So are there 6 pairs? Are there 12 pairs? How many are there? So there are 12 total pairs of ribs, which means a total of 24 individual ribs. Someone's snoring. Okay. So we've got 24 total. That seems like a number you need to know. Specifically, there were 12 pairs. They attach posteriorly to the thoracic vertebra. So posterior means the back. Okay, so here's the posterior view. So they're attaching back here on this section of the spinal column we just talked about. There are some that attach again to the front, aka the anterior side, via the costal cartilage, which we already talked about. So then there are ways to classify these ribs. So the true ribs are pairs 1 through 7. Okay, they are going to attach to the sternum via that costal cartilage. Right, there's a full connection. Okay, think about what is here. This is where a lot of the important stuff really is hanging out. Your lungs, your heart, all that. Oh my goodness, you are so loud. They're going to hear you. And again, they're attached to that sternum. You're making me lose my train of thought. All right, then we have our false ribs. These are pairs 8 through 12. So they're either going to be attached to the sternum via a shared piece of costal cartilage, or they don't attach at all. Okay, so that's why we call them false. Like they don't make that full protected circle kind of a thing. Ribs 8 through 10 will attach to with the shared piece of costal cartilage. Ribs 11 through 12 are the floating ribs. Okay, that's these guys down here. So they don't really attach to the sternum at all. Some people forget that those are there. That's why we call them floating. They're like they're floating ribs. Okay, they're not actually attached to the front. Like they don't complete the gauge. All right. Dang it, it's already it. Yeah. Okay. That was easy. All right. So make sure you filled out your notes as we went. Right, to show me that you completed the notes and didn't just write them down from the slides and just been like, yeah, no, that totally makes sense. I want to see on the vertebral column slide notes that you wrote down the memory trick, the breakfast at 7, lunch at noon thing. And then I want you to put a heart with a smiley face at the bottom of your thoracic cage notes. So I know you did those and watched the video as well. So if you have those 2 things on your notes when you show them to me, you're good. If you don't have those 2 things, you're missing something. So let me know if you have any questions, and I will see you in the next video. Bye.